Well, this scam is popping up all over the country, and they're showing up on doorsteps, at health fairs, at senior centers, and they're offering this genetic testing with all hopes of getting your Medicare information. So,
state officials tell me that these tests are not only unnecessary, but they could also lead to confusion about your health condition. And once a crook gets your Medicare number, they can use it for other fraud schemes. So you have to be really careful.
Taking your number, sending it in, and getting money back.
Exactly.
This morning, we executed Operation Never Say Die. Federal agents from multiple agencies descended on fraudsters throughout Southern California, executing multiple arrests and search warrants. We arrested 8 defendants, including medical providers such as nurses and doctors.
The conference room on the 4th floor was empty when they arrived. No warning, no press. Just federal agents, forensic accountants, and a sealed warrant authorizing the seizure of every hard drive, every bank record, every email server in the building. It was 6:47 a.m. The receptionists wouldn't arrive for another hour, but by then, the entire operation would already be frozen. This wasn't a raid on a drug cartel or a weapons ring. This was a takedown of a genetic testing company. And what the FBI found inside would expose one of the largest Medicare fraud schemes in American history. A machine that had been billing the federal government for hundreds of millions of dollars, using a weapon most people never saw coming: their own DNA. The scheme had been running for years, quietly, precisely, and it had turned elderly Americans into commodities. It started with a phone call. Somewhere in rural Florida, an 82-year-old woman answered her landline. The voice on the other end was polite, professional. They said they were calling on behalf of Medicare. They said she qualified for a free genetic test, cancer screening, early detection, no cost to her. All she had to do was provide her Medicare number and swab the inside of her cheek. A kit would arrive in the mail. Simple, safe, preventative. She said yes. So did tens of thousands of others. But what they didn't know, what none of them knew, was that the test wasn't free. It was being billed to Medicare for up to $10,000 per person. And in most cases, the test itself was medically unnecessary. The results were never reviewed by their doctors. In some cases, the tests were never even processed. The swab went into a lab. The claim went to the government. And the money flowed back into a network of shell companies, offshore accounts, and coordinated kickback operations spanning multiple states. By the time federal investigators identified the pattern, the scheme had already billed Medicare for over $700 million. The question wasn't just who was behind it. Within weeks, the case was handed to the Department of Justice Healthcare Fraud Unit, then to the FBI, then to a multi-agency task force that included the Department of Health and Human Services Office of Inspector General, IRS Criminal Investigation, and the U.S. Postal Inspection Service. What they uncovered wasn't just fraud, it was infrastructure. The operation worked like this. Telemarketing companies, operating out of call centers across the country, would cold call Medicare beneficiaries. They'd offer free genetic tests under the guise of preventative care. Once a person agreed, their personal and Medicare information was passed to a network of telemedicine companies. These companies would have doctors, many of whom had never met the patient, sign off on orders for cancer genetic testing panels. Those orders were then sent to labs that processed the tests and submitted claims to Medicare. Each test could be billed for anywhere from $5,000 to $11,000. The patients received nothing of value. The doctors were paid per signature. The labs took a cut, and the orchestrators, hidden behind layers of LLCs, nominee owners, and international wire transfers, collected the rest. The system was designed to be invisible, distributed, difficult to trace. There was no single location, no central office, just a web of coordinated entities, each playing a small enough role to avoid detection on their own. But federal investigators began pulling threads. They subpoenaed bank records. They traced wire transfers. They identified shell companies in Nevada, Delaware, and Wyoming that existed only on paper. They interviewed doctors who had signed thousands of orders without ever speaking to a single patient. And they started building a map. What they found was chilling. The scheme wasn't the work of a lone fraudster. It was an organized network. Call centers in the Philippines. And the indictments came in waves. April 2020, 9 defendants charged in the Southern District of Florida. June 2020, 14 more charged in the Eastern District of Texas. September 2020, 12 additional conspirators charged in the Middle District of Tennessee. The charges included conspiracy to commit healthcare fraud, wire fraud, money laundering, and kickback violations. The potential sentences ranged from 10 years to life in federal prison. And then came the whistleblower. In late 2020, a former employee of one of the telemedicine companies came forward. She had worked in patient intake. She had seen the scripts the telemarketers used. She had watched doctors sign off on orders in bulk, sometimes hundreds in a single sitting, without reviewing a single medical chart. And she had been told, explicitly, that the goal was volume, not care. Her testimony opened a new door. She revealed that several of the doctors involved had been recruited specifically because they had active DEA numbers and clean licenses, making their signatures valuable. They were paid per order. Some earned over $300,000 in a single year, and many of them knew exactly what they were doing. But more troubling than the doctors were the patients. Investigators began interviewing Medicare beneficiaries who had been targeted. Many didn't even remember receiving a genetic test. Some had never heard of the lab that billed Medicare in their name. Others had been told the test was mandatory or that their doctor had requested it. A significant number were cognitively impaired, living in assisted care facilities, or simply too trusting to question a call that claimed to be from Medicare. They had been used, systematically, at scale. And the financial toll was staggering. The government estimated that the total loss to Medicare exceeded $700 million.